One of the major cause of cardiac arrest is heart attack. So, what exactly is heart attack, and how can it lead to cardiac arrest? Firstly, let's have an insight of what cardiac arrest is. Although most people might think cardiac arrest and heart attack that they are the same thing because they have cardiac heart, so they are somehow the same thing. But no, they are just related, but they are not exactly the same thing. What cardiac arrest is a type of condition whereby the heart just stop working. The heart that used to pump blood to other part of the body now, they used to pump oxygen-rich blood to other part of the body to supply them, to nourish them. The heart, it should just stop working. So if it stop working like that, it's cardiac arrest that they've said happen like that. But what used to happen that heart to stop working? As we all know, as I said in one of my videos, that video I said documentary of the heart that I posted on YouTube. So I said it there that the heart does not rely on the nervous system for generating its own electrical impulse. No, electrical impulse is what used to make muscle contract. So it does not react on it does not rely on the nervous system for it to generate its own electrical impulse. So by using that generating the electrical impulse, it's generating it through synovial node. So that synovial node contains various pacemaker cells. So those pacemaker cells now, they don't like to generate the electrical impulse that's going to make the heart contract. So if the heart contract, that's how the blood is going to pump. So but those pacemaker cells now, they are working in rhyme, like there's a particular rhyme that is the work. So if that rhyme they are working with, if something should just disturb it, like maybe an external disruption does disturb this rhyme, it's going to start malfunctioning. And if you start malfunctioning like that, that is what can make the heart stop and cardiac arrest is going to happen. So now, what is now heart attack and how can it lead to cardiac arrest? So heart attack is also known as myocardial infarction. So what that myocardial infarction is, it's a type of condition whereby the blood flow to the heart muscle, to a part of the heart muscle, is suddenly reduced or blocked completely. And if the blood flow is reduced or blocked completely, there's going to be insufficient oxygen reaching the heart, because you know how this blood that is to move, it's oxygen they are carrying and taking out carbon dioxide. So if the blood flow to the heart is reduced or completely blocked, so the heart now is going to be insufficient of oxygen. And if it's insufficient of oxygen, that part that is insufficient of oxygen in the heart is going to suddenly start dying or start degenerating. And if that part of the heart that is having insufficient oxygen, if it have started degenerating like that, you know that it's not going to be working well. And if it's not working well, it's going to be affecting how the heart is pumping to other parts. But what is to cause this blockage? So as we all know now, the coronary artery is the artery that is taking blood, that is allowing for blood flow to the heart, oxygen-rich blood flow to the heart. So that coronary artery now, there are some things that can happen to it that can make it blocked. Before that, there are two major coronary arteries, the right coronary artery and the left coronary artery. So sometimes now, this coronary artery now, so sometimes their lining can become damaged. What can make this lining become damaged? There's something they call plaque. So that plaque is just an accumulation of cholesterol, bad cholesterol, fats, some macrophage that are sent to clear up that cholesterol, some another waste product. So that plaque sometimes it can become accumulated in the lining of the coronary artery. If you look at the coronary artery now, let's imagine it as a pipe. So it's just like a pipe. So you know that there's a place where water do pass, and there's a place that make up the pipe. So let's assume that pipe now, those places that make up the pipe, there's not something that's accumulating in it. You know, if it's accumulating, it will start swelling up, and if it's swelling up, the parts where water is to pass, it can suddenly become narrowed and blocked. So that's what exactly is happening in this coronary artery. So the lining wall, the wall of this coronary artery, those plaque accumulation, they can start accumulating and start getting thicker, making the artery get thicker. And if it's getting thicker now, the lumen where the blood do pass to is going to start getting narrow. And if it's getting narrow, that's what is to cause that obstruction and blocking. And if there's blockage there, the blood flow to the heart is going to reduce. And if the blood flow to the heart is reduced, the oxygen that is reaching the heart is going to reduce, and that is going to making the part affected, is going to making it start degenerating and dying. So that's what heart attack is. But it's not something that just happens suddenly like that. Those plaques, they will be accumulating. So one time, if the accumulation have gotten too big or too thick, so sometimes the plaque can just rupture. What I mean by rupture is that it can just scatter. So just scatter anyhow. And if it should scatter anyhow, this time around, what the body is going to do is that going to create a blood clot around that plaque. What blood clots mean is that, you know, if someone wound now, so the way those wounds used to be that the blood will not just be rushing out from that place, rushing out. What used to happen there is blood clot. So just the body is going to create a blood clot through that plaque, so it's not going to cause too much further damage. But if that blood clot have been formed like that, it's not going to cause complete obstruction to blood flow to the heart, to the coronary artery. There's complete obstruction, that is when the heart attack is going to start. So at first, within 20 minutes, it's going to be showing little sign. Within 40 minutes, the sign is going to be getting more intense. But by 6 hours above like that, more than 6 hours, if you're only getting more than 6 hours like that, the damage is already getting permanent. Because that time, the heart have been starved of oxygen for a very long time, to the extent that part that is affected will just start getting damaged and it can start degenerating. And if it have reached that stage where it has started degenerating like that, it cannot regenerate back. And if it's not regenerating back now, so the body is going to create something they call scar tissue. So that scar tissue is just going to be there. The cells there are dead, but the scar tissue is just there. It's not going to be contracting, it will just be there. And if it's not contracting like that, the other parts of the heart, that are not affected, they are going to be working times two, times two, times two. So if it's working times two like that, so that what is going to be causing other complication, because the heart is going to be working more than how it's supposed to be working, because the scar tissue that is forming that part that is damaged is not going to be doing anything. Those other parts that are going to be doing all the other things. So that's what is going to be causing other complication, because it's going to be doing more work than how it's doing. So other complication can come in. So other complication including cardiac arrest and all other type of complication. So that is how heart attack can lead to cardiac arrest. But sometimes the heart attack can be so worse, like the blockage that lead to the heart attack can be so worse to the extent that when it ruptures, like when the plaque in those coronary, when it ruptures like this, it's going to rupture severely to the extent that the part that's going to be affected immediately is the part that can lead to cardiac arrest. So that's what it cause sometimes. So people that have heart attack immediately they'll just have cardiac arrest, because the coronary artery that is affected at that time is too severe. The coronary artery that is affected, so that affection, the effect is too severe to the extent that immediately lead to cardiac arrest. But what exactly used to cause this heart attack in the first place? What used to cause this heart attack are the things that are causing damage to the artery, because it's the artery that is causing, is the artery obstruction that is causing the heart attack. So the things that are causing damage to the artery are what is to cause the heart attack. So things that is to cause the damage to the artery include high blood pressure that is not maintained, diabetes, if there's high cholesterol, so obesity too can cause it. So stress, unhealthy diet, if someone just eating empty, so unhealthy diet too can cause it. Lack of exercise, sometimes so genetics can cause it, and a lot of other things. But the major cause of it is high blood pressure that is not maintained, diabetes that is not maintained, and smoking too can also cause it. Because the high blood pressure now, you know that the blood, high blood pressure, those blood, the way they are going to be pumping, they're going to be pumping with high pressure. So if they are pumping with high pressure like that, yeah, they're going to be damaging line, because something that is going with high pressure, just like I see water now, is passing through a pipe with high pressure. And at the point in time, the pipe can get damaged. So that is what is happening. So if there's high blood pressure, it can also damage the lining of the artery. So diabetes too. So for diabetes now, it can cause the heart attack in a lot of ways, because diabetes is when there's abnormal regulation of glucose. So because those glucose are there, it can do a lot of things, including if there's too much amount of glucose like that, it can lead to damage to the lining of the artery, coronary artery. Is also, so diabetes too used to give high tendency for blood clotting. Now, as I said it, that the plaque that there, if they're rupture, so blood clotting going to happen. So the more the diabetes, the more the ability for the blood clots to happen intensively. So another thing again is smoking, as I said, yeah. So smoking contains a chemical known as nicotine. So that nicotine, what is to do is that the vessels, is a vasoconstrictor, I mean. So what is, if they mean vasoconstrictor, is to make something get more and more and more narrow. So if it's a vasoconstrictor, so it's even going to making it narrow even before the plaque build up even happen, before the plaque build up make it more and more narrow. So that is smoking too is fine. Other things too are things that can cause it, and the sign that can be seen is chest pain, pressure in the chest, shortness of breath, dizziness, the pain that is spreading from the arm, the jaw, the neck or back. All these symptoms, they can be a symptoms for that thing. That's why it's the best, if someone feel those symptoms like that, it's the best to just go to doctor outside. They're going to know the main thing that is causing it. So those things too, they are also symptoms for heart attack also. There are sometimes that this heart attack, it may not even really show symptoms. And what is to cause it that will not show symptoms? As I said, diabetes is also one of the unmaintained diabetes is also one of the cause of heart attack. And this diabetes on its own, if it's the one that is causing that attack, there are some nerves that are around the heart that is to make people feel pain if that attack has started. So what this diabetes is going to do is that those nerves that is to make people feel the pain, so it's going to go and damage those nerves. That's to the extent that if those nerves are damaged, if those signs have started happening, that the heart attack has started happening, so there's no nerve that is going to send signal that okay, it will send signal of pain that this thing is already happening. So as a result of that, there will be no symptoms for it. So the way it can be prevented is through if healthy diet that is not much in cholesterol, good exercise, reduced smoking. Other thing is regular checkup. What again? So regular checkup, controlling of blood pressure, maintaining of diabetes, and maintaining healthy body. If someone is healthy, that yes, healthy body weight, not too much. Just maintain exercise, maintain good body health, and regular checkup. So these are the things that can prevent heart attack. And if this heart attack happen, the way that it can be corrected is the doctor, they know how they to do it. So they'll just make sure that coronary artery now that is blocked, they are going to make sure that the blood flow to the heart is now getting more improved. Because if the blood flow to the heart is getting more improved, the blood is going to reach the heart and the heart is going to be getting more nourished. So that is the body. There are even some heart attack that they are going to be developing for a very long time. That by the time it just happen like this, those pain will just start. Those symptoms are just going to get very intense. That if they are not quickly watched the patient to hospital, it can lead to severe complication and even death if it's not taken care of, that is ignored like that. That is all about heart attack and the way it leads to cardiac arrest. As I said, the way it lead to cardiac arrest is that sometimes it can be directly that the coronary artery that is affected is very severe, or is even the one that is connected to the part that can lead to cardiac arrest. And sometimes, even though it's not caused directly, if the heart continue to work times two, that maybe the heart attack might have happened, so it's not treated or taken care of, the heart can start working times two. Another complication can arise. Among those other complications is cardiac arrest. So I'll still be making another video on cardiac arrest to explain it too in full like this. So please, if subscribe, if it's on YouTube, please subscribe, and if it's for Facebook and TikTok, please follow. Thanks. So see you in the next video. And also help us share this video. This video is very important because it can save a life. It can save a life.